Two words that get used interchangeably often are strain and sprain. Most people don't really know which word to use in what situation, so I'm going to go over what the difference is. Strain refers to damage to a muscle or tendon. Now, a tendon is how muscles connect into your skeletal frame, inside to bone. So if there's muscles that run up alongside the spine here, a tendon is how it attaches to the bone itself. A ligament attaches bone to another piece of bone. So a disc here would actually be a good example. It attaches a bone to another bone. The most common sprains that you've probably heard of are an ankle sprain or an ACL tear or sprain inside the knee. And so with a strain or a sprain, there are different levels of damage. As you can see in this image here, there's grade 1, 2, and 3. Grade 1 is the most common. It just means there's a small injury, maybe there's some swelling, but really nothing serious. Grade 2 means that there are some fibers that are actually torn. Typically, it depends on the severity of the injury, whether it will require surgery to reattach those fibers. And then grade 3, as you can see, is a complete tear. Nothing is attached anymore. Typically, this is going to involve surgery to reattach it. However, if you're above a certain age and surgery is potentially a risk, depending on which muscle or ligament has actually been torn, they may not recommend doing surgery because you might be able to function during your day-to-day without that being fully repaired. So, strain refers to muscle or tendon, sprain refers to ligament. Usually, the most common injuries that we're going to see are a grade 1. They're uncomfortable, maybe painful, maybe they inhibit you for a little while, but they're nothing super serious that's going to require massive intervention. They've actually recently changed the recommendations for these. You've probably heard of RICE. Now they recommend a new acronym, so I'm going to go over that in a different video.